Abbas Mohammadi.
Correct.
Yes,
Good.
thank you very much.
Yeah.
Columbia Dental, always great to catch up with you. Obviously, everyone deals with this in America, their mouth and their teeth. Everyone has a different relationship and feeling toward dentistry. So I think it's really great to sort of let people know what's going on in the industry and also allay some fears that some people still have. And I think what with Columbia Dental, I think the model is so fascinating. Can you just talk about, how people can go and do a one-stop shop with you? It's not just about a cleaning or going somewhere else for this piece of work, and how you can do it all in one place.
Yes, you're correct. We have all aspect of dentistry. We have all six different dental disciplinary, and also we have an in-house laboratory all in one place, so we can provide everything, from simple preventive care to major reconstruction surgery, all and for procedure, etc. Give you a little bit historical background. I came with that model when I was a student at Columbia University. My roommate wanted to fix some stuff, so but we went, at that time, I was going in Manhattan at school, so they didn't have like a Home Depot, so there was like a hardware store in Manhattan, so you had to buy just like the screw and minor stuff, and for other stuff you have to go to another place.
It was a pain.
Yeah, it was a pain. So we poor and we didn't have car, but we rent a car. We went across the bridge in New Jersey and we went to Home Depot. When I arrived to Home Depot, I was amazed that you can buy TV, you can buy everything, and it's not just the hardware store.
Yeah.
And I got fascinated by that business model because that was my first experience here in the United States, and I was asking, my roommate, why we have to go to New Jersey to, for the hardware and stuff. I said, no, we go, it's worth it. I said, really, we have to pay for rental car and everything? He said, yeah, don't worry, it's worth it. And when I went there, now I understood. So we went, we did whatever we need. Within few hours, we came back, and probably we saved money. Even we had to pay for rental car and everything, because we did all the shopping. And when you're school, you have so many assignments to do. You're not having too much time. So
you want to bring that you brought that concept.
At that moment, when I opened my office, always that idea resonated in my back of my head. This is why dentistry is not like that. Why we have to go from one place to another place. Why the patient need to wait, to be in agony, with pain, referral, send the cases out to the laboratory. So, of course, so when you're...
It makes total sense. And so when you started in Connecticut, how long ago was that?
Around 25 years ago, year 2000, I started.
And with one place?
With one place.
Yeah, now it's how many?
Of course. Now we have 12 locations. Obviously, when I started as a one person. I didn't have dental laboratory. I didn't have all the location. Sure. But the idea was there. I work hard, save the money. Then, the next step I did, I hire other specialties. Then I opened my own dental laboratory. So slowly, gradually, I expand upon the idea of the Home Depot. Yeah. Over the years.
That's great. Dr. Abbas Mohammadi from Columbia Dental joining us here. And, obviously you didn't start off that way, but that's the model now. But what else has led to this sustained success and expansion of this business? Because it's really like an American success story, right? But it's not just the fact that you can do it all on one roof. What other elements to what you do distinguishes you from others?
You have to take care of people. You have to treat them like your own family. You have to stand beyond your work. That's the bottom line of it. You can't treat people like just a number. They are people. And that's, I think, is beyond every success business. I look like I'm advocate for the Home Depot, but
That's a great
but
story, though.
but that's the great story. But I do believe that is my model actually, not to advocate for a Starbucks. Harold Schultz says that you wanted to grow but stay small at the same time. So I try to combine these two models together, have everything, but at the same time, like a Starbucks, every morning I go, they know me by first name.
Right.
Hey, Abbas, how are you? What do you want today? That personal connection, it make a huge difference. And I try to keep both concept of the Home Depot and the Starbucks in the same way. And believe me, I'm not either part of a Starbucks or
No, I
no
get
Home
it.
Depot,
I
but
get it.
these are the stories of the success of the American businesses success. So I'm trying to basically rob those ideas from those other, companies.
Well, there are some universal truths to both success stories, and
Correct,
you're trying to
correct,
implement them in your
correct,
own business.
correct.
So it makes total sense. The guy Rizdal is how I built this the podcast. He does this origin stories of these businesses, and both of those make total sense. And it translates to what you're doing. We're talking with Dr. Abbas Mohammadi from Columbia Dental, and outside of those two things, in terms of dental technology. I always am amazed. Like when I need to get my bite wings, it seems to change all the time, and then it goes back to it's always different. There's always innovation in this business.
Correct. Yeah.
And so what's happening now that's exciting?
Again, like anything else, automation, robotic had been AI been
How
very.
does that help you? How does something like AI help you?
Exactly. Is in our digital laboratory, we call it digital laboratory. Is now we fabricate. Older days we used to manually wax up the teeth and cast it and so on. So these days we design the crown or prosthesis in the computer. AI is helping us to design it, to give us idea where the margin is and so on. And then the milling machine, which basically is a robot, is precisely cutting those zirconia blocks. So we get a superior product, more precise.
Right.
And
You can 3D print a lot of stuff, I'm sure.
Exactly. Yeah. Okay, so that's basically so is it my sons, at one point I have like a 13 to 15 lab technician. Right now I have less lab technician, and we do way more production, and we are using our forces in a different direction, not down the the way that like we don't lay enough people, we retraining them on a different aspect, and everything would be the production is at the end of the day will be higher, the cost is goes less.
So it's not so much that because my question was going to be how does this enhance care, and it just makes your business more efficient, but the help to the consumer is that it eventually brings down the cost to the consumer.
Correct. It brings the cost to the consumer. We used to, spend way more money when we send those crown overseas because it was so expensive labor to fabricate those prostheses. Now, but doing it in our lab is our cost is going to is less.
We're talking with Dr. Abbas Mohammadi from Columbia Dental, but there's still people out there who are frightened to go to the dentist.
Correct.
And how do you deal? I mean, back in the day, like when I had the raincoats and the drilling, and and whether it's a toy or whatever, it was the dentist had to sell things a lot more. Now it's much better, much easier. But still, how do you deal with people who have a real? Because if they can't relax in the chair, you can't do your work.
Okay. The best approach is education and change the bad experiences. Obviously, there are modalities there, like you can use nitrous oxide, sedation, so and so. But if you want to change the anxiety, the best way to change the experience and communicate with the patient. That's the best approach it is, because the medication are wearing down. The dental work remain the same. So these people, we give them nitrates, we give them sedation, we take care of one minor issue until the next one they come. But they're not coming because they keep procrastinating. So the fear remains. The only way to fight that anxiety by establishing trust.
Yeah, that's true. And then over time, you build it up. And
Yes.
if they had a bad experience somewhere else, you just got to take some time, maybe
Yes.
it's a couple of visits. And,
Just give them a good experience. That's the only way to do.
and in terms of, you said 7 locations?
12.
12. Okay. So what, like, I mean, you've established this incredible business. What are your goals? Can you keep your sort of localized treatment of people and get bigger? I mean, are you going to be in more states, or are you going to be in more places in Connecticut, or are you at the right size right now?
No, I'm not in the right size. I mean, the way I look at life, you need to keep getting better and
I feel like
bigger.
this model could
Yeah.
go all across the country.
I hope so. I hope so. One day would go.
Is there anything else that we missed that you want to touch on?
Not really. I think we cover everything.
Dr. Abbas Mohammadi from Columbia Dental, thank you so much.
Thank you so much.